Welcome to the Richardville Report with Senator Randy Richardville. This program comes to you each month from Lansing to keep you informed on issues important to Southeast Michigan. This week, Senator Richardville discusses autism, its diagnosis, care and treatment, and recent legislative action listing autism among those conditions covered by health insurance in Michigan. This month's guests are Dr. Colleen Allen from the Autism Alliance of Michigan and Michigan Lieutenant Governor Brian Calley. And now, here's Senator Richardville.
Hi, I'm Randy Richardville, State Senator from the 17th District and the Majority Leader for the Michigan Senate. A recent study by the United States Centers of Disease Control and Prevention shows that the diagnosis of autism nationwide has risen dramatically in the last 20 years. 1 out of every 88 children nationwide now are identified as having autism spectrum disorder. Here to talk about the condition and some exciting new legislation to help with children with autism here in Michigan, our Lieutenant Governor, Brian Calley, and Dr. Colleen Allen. Dr. Allen is the President and the CEO of the Autism Alliance of Michigan. Thanks for being here and welcome. It's really nice to have both of you here because over the last 4 or 5 years we've had the opportunity to work together on this legislation. It's probably the best piece of bipartisan legislation that I've worked on in the 15 years or so that I've been up here. Brian, you've had a personal experience, and I know you take this issue very personally as well, Dr. Allen. But Brian, you know, the story that I think I'd like to start with, if you're okay with it, is telling us a little bit about you sitting in the committee, hearing the description of what autism and its symptoms are like, and how that affected you and your family. And I know that that's a very little piece of why you got involved in trying to pass this legislation and work it out, but I think your personal experience would be good for the viewers. Would you be okay with sharing that?
Yeah, I'd be happy to. It was really kind of a surreal experience because the issue of dealing with autism and all the costs and the things that families have to deal with was fairly academic to me before. I'd supported this effort, supported the effort of passing autism insurance reform before based on the economics, because taxpayers today have to spend so much money to take care of people for their whole lifetime because we don't give kids with autism what they need when they need it. And so, you know, as we'd gone through this process, though, my wife and I, with our second child, my daughter, were experiencing all kinds of issues and problems. Just every single thing was so difficult, and yet nobody could really pinpoint what the problem was. We knew there was something wrong. We knew there was some kind of issue, and it really wasn't until I was sitting in committee and hearing testimony from a young man with autism who had received behavioral therapy at an early age and had developed just wonderful communication skills. He had testified in front of the committee, and the gist of his testimony was what he was like before he received the therapy that he needed. And that was really when all the dots came together for me, that the thing that our pediatrician wasn't able to tell us and the thing that other professionals within the education system and the medical field and where I live, where there's very little experience with autism, it became clear that those symptoms that he described, that described my daughter so well, and I knew at that point she has autism.
So just to be clear, so that the viewers understand this, here you are, you weren't Lieutenant Governor at that point, you were a state representative with a young family, you've got some struggles at home with your daughter and some behavioral things you're not really sure about. You're sitting in the committee having somebody explain what autism is like and what the symptoms are, and now it's just starting to hit you for the first time that, hey, I think maybe my daughter has these symptoms, maybe she has autism and I should have her checked out. Is that really how it happened?
It is. It was just such a powerful moment. It was almost like, I think about like connecting dots, that there's this riddle and we couldn't figure it out, and a lot of professionals couldn't figure it out. And then it was just very comprehensive description of what it's like, what it is, that finally brought it all home. And then at that point, it's a hard thing to face. The diagnosis is a hard thing to face, but even after you face it, you find out that the hard part is yet to come, that there's so many challenges just getting the right therapies and access to the right professionals to get kids with autism what they need, and that's really what kind of charged this effort or this interest in trying to make sure that, yeah, as the Lieutenant Governor, I was able to find what my daughter needs, but regular people out there that are struggling with this had no chance.
Well, you know, I chaired a work group for the past few years, several years ago, and during the summer I went to places like the Detroit Medical Center. We went to the Autism Center at Eastern Michigan University. We were here in Lansing, and then we went to Hope Network over in Grand Rapids. And I listened to a lot of families tell their story. They were different stories than your story, but they were personal. But there was one theme that went throughout all of them, and that is the earlier that you can detect autism spectrum disorder, the better it is, the better chances are that you're going to be able to turn this around. Now, Dr. Allen, you are the president and CEO of the Autism Alliance of Michigan. And can you tell us if Brian's experience is typical? Do you think, misdiagnosed or undiagnosed children out there? And if people out there maybe think, God, I've got some issues with my young child right now, and it sounds like this, what should they be looking for? What's a typical story that you hear?
Well, let me take your first question. Brian's story is actually quite common, and what was always interesting to me in listening to him speak about it is that that's also common over in Southeast Michigan, where we actually have many more resources than where you're located. And it's still a little baffling to me, and maybe I'm too close to it, because I really feel like there has been great efforts towards awareness. Now, in some respects, awareness hurts you, because what you'll have is families that are dealing possibly with other issues, like a child that maybe is just a late talker, and immediately they begin to think that it could be autism. And so they're looking for some of those symptoms that may actually be part of typical development. But then we have just as many on the other end, literally, of the spectrum who are denying away real deficit. And, oh, you didn't talk till you were 3 years old, don't worry about it, you know, grandma will tell the family. And what we really would like to start doing even more intensively here in Michigan is not just talking about the trio of core deficits, but really getting to parents, getting to professionals even more importantly, because it's who they turn to.
You said something, the trio of core deficits. Yep. That's probably something that you and some of the professional people might know better than
I'm happy
me.
to
Could you
explain
that a little bit?
Absolutely. Okay. So what defines autism are the deficits in the areas of communication, language, social interaction, and then what we call restricted repetitive behaviors. Okay. And that the social and communication, I think most people can envision, but just to give you examples on communication, you can have a child who is at the lowest functioning end, who is nonverbal and could stay nonverbal through their life, or you can have an individual at the highest end of the spectrum who has fully functional language, but language that's considered odd or atypical because, for example, they have to speak about or can only speak about one topic in particular. Everything you ever wanted to know about Star Wars is my favorite example, because I find so many kids with that particular interest and even adults with that interest. And what happens is that rigidity or restrictedness, it begins to interfere with the socialization, because these are not individuals that pick up the kinds of cues you look for that demonstrate someone's interested. Like, you're looking at me right now, you're nodding your head, you're orienting towards me, and those behaviors are truly missing in some respects from these individuals. So the trio is communication, the social deficits, and then the unusual or atypical behaviors.
The repetitive behavior. That's seeing the same kind of thing they're doing or saying the same thing.
And in children, what I think the Lieutenant Governor might attest to is, you know, it may not necessarily be restrictedness of conversation that you get in older or high-functioning individuals, but a child, for example, who is incessantly lining up toys or flapping in the corner or obsessed with shapes or letters and ordering according to patterns. Those are the kinds of behaviors you see in some of these younger children.
Okay. Well, and you know, when I went around and visited the autism centers and talked to people, and professionals, not just the family members of autistic children, but also professionals. Early detection was important, but also there was a link in some cases between children with autism and a sibling. There was a higher incidence. First of all, I think it's about 4 to 1 boys to girls, so there's a better chance of a boy having autism than girls. And there's also a higher incidence possibly among brothers and sisters. So if you have an autistic child, there's a better chance that you would have another autistic child versus if the first one wasn't. Is that true?
Very true. Also true is that that sibling or that twin may experience a non-spectrum disability, which is also common. So a speech delay, for example, or learning difficulty, attention deficit. When you look at family trees, what's also common are psychiatric presence of more significant psychiatric disorders in children who have autism. So unfortunately, there's no clear link. Autism is a multi-gene disorder, so finding what exactly causes what is like a needle in a haystack. But there's great research going on right now, and certainly we're all waiting for that day to come when we can pinpoint some of the cause.
Well, I want to talk about the evolution of the legislation, how it got to the point where we passed it. I also want to talk a little bit down the road before we finish about some of the professionals that we've trained in Michigan, that because of the lack of a network, we were actually sending people out of Michigan to perform this kind of behavior analysis, this treatment to autistic families and children outside of Michigan, because we didn't have coverage in Michigan, which was the brain drain that we've all talked about. That was terrible because we were encouraging that. But before we do that, can you tell me a little bit more about the Autism Alliance? What is it? It's an alliance of who and what is your mission, please?
Absolutely. So the Autism Alliance in Michigan is a statewide network of organizations that provide services or supports to persons with autism. And it includes a number of universities. I think we've tapped probably 90% of our universities at this point, which means we have a partner there. We have a researcher, we have an administrator, somebody who resides on our advisory board. We include health systems in our network or alliance. We have some CMH agencies that are also part of that. And what we've really been pushing this past year with legislation, actually facilitated some of this, was the collaboration and communication across the parent groups. And anybody who's been in Michigan for a while in the autism community can attest to the silos that exist here. And some of that is rooted in strong beliefs around a particular therapy that should work, or one that has no evidence behind it, and why are they doing that. And the Alliance is really about improving the communication and collaboration so that we can push statewide initiatives that affect all. And I think the legislation was a great example of that.
Well, and you've had some champions, I would say, of autism, and also the stakeholders, I think, is a group of people that you pull together to bring those silos down and make it all part of one unified effort. Dave Meter, the Chief Financial Officer at Detroit Edison, Steve Darcy over at the Detroit Medical Center, Jim Price, who's the announcer for the Tigers. These are the kind of people that are relatively high profile. I guess I should include the Lieutenant Governor.
He had a little something to do with it.
But not just them, but there are average people that have been affected either directly or indirectly, families, etc. And you've really gotten a forward-thinking ball moving forward. Is that
Absolutely.
fair to say?
I think the Lieutenant Governor would agree that the reason we did that was some of the earlier efforts on your own part, but that we were able to pull together, I think more succinctly, the researchers when we needed some advice on bill language, for example, when we needed providers to step up and contact families to call their representatives, whatever the issue was, it just seemed like a better coordinated effort. And we're hoping on the implementation side we're going to see the exact same thing. We're taking that momentum and looking at who we reach right now and put together a plan or strategy that will allow the state to ramp up for those providers and to get existing centers prepared for the reimbursement issues that could come along.
Yeah, well, there's no question that a lot of the momentum that occurred, a lot of the information that people didn't know that was shared with them, had a lot to do with the alliance and your involvement. So we certainly thank you for that. And now, Lieutenant Governor, you and I got together in the last term, and there was some legislation that was introduced that had been introduced before. But basically kind of dictated an unfunded mandate to the business community. And while it was well-meaning, I think, the business community, which we're trying, you and Governor Snyder are doing the best you can, working with the legislature on creating a good environment for job growth. And here, there were some people that said, well, let's throw the cost at business and let's make businesses pay for this coverage, even though, they're not the ones that caused it, which we thought that could possibly move things in the wrong direction regarding fueling the economy. So we had to come up with a compromise, a way to fix that problem. And I think the key to that, and correct me if I'm wrong, I'm going to ask you to tell your part of the story here, was when Dave Meter took the Harvard study and said that the average autistic child in the United States costs some $3.7 million over the lifetime. And you being a former banker, businessman, me doing some analytical work with manufacturing companies, if you look at that 3.7, a bulk of that money came from state and federal government. So now a new question came up. Well, why should businesses have to pay business taxes and pay premiums for insurance coverage when most of the return goes back to the federal government or the state government? Instead, what if the state government invested some taxpayer dollars that would reduce the overall costs, and then we would be able to afford it without penalizing the business community? And that was really, I think, the piece that, well, kind of like the autism puzzle piece that made the puzzle finish, is to be able to get to that compromise which brought Republicans and Democrats together to do the right thing. What do you have to say about that?
Yeah, the nice thing about the way that this final package came together is that it's a very comprehensive solution across the board. So before, there was always pieces of the insurance industry that were left out, and there was always this cost that was being imposed because of the nature of the insurance reform. And when you put two things in there, which was this reimbursement option that was introduced this year, it not only does it cover everybody across the entire insurance spectrum, that being self-funded companies and traditional insurance, that everybody qualifies for this reimbursement option, but you also prevent the spread of cost of the coverage to families that don't have autism as part of the issues that they're dealing with, and you spread you prevent the spread of the cost to the business community at large. So what you say is that the taxpayers right now are paying literally billions of dollars in extra costs because kids with autism grow up someday and they live off the government for the rest of their lives, when we know that half of kids can reach typical function if they get what they need when they need it.
I think that's important.
Save billions.
Yeah, can you say that again? How many? About half of the kids, if they get applied behavioral analysis, ABA,
right,
we know that they can be mainstreamed versus having the government basically take care of them for maybe the rest of their lives, right?
In most cases, it is the rest of their lives. The unemployment rate for adults with autism is over 90%. And you talk about these things like, earlier we talked about some characteristics of autism, things like repetitive behaviors or some tendencies to really obsess on certain topics. The interesting thing that we've seen, though, is when you put together communication and social skills that you can gain from behavioral therapy, this ABA therapy that you'd referred to before, when you put that together with these tendencies to really focus in on things, if the things if you direct that focus in on productive things, you can get some of the best, brightest, most brilliant employees you'd ever hope for in a person with autism. I'll just give you one example. In my office right now, I have what you'd consider to be a high-functioning individual with autism who is just starting out in college. And his compulsion is American history and constitutional law. You think about, Dr. Allen gave an example of a compulsion being
Star
Wars. Well, what do you use Star Wars for? But this is somebody who knows more about constitutional law and American history and everything that makes our country how it is and how our system of making laws work, knows more about that than anybody I know.
Well,
and
that's really good for the era of term limits too, isn't it? Because we need people that have that kind of background.
It's exciting. You know, it's exciting to think about the idea that something that others for years have considered to be a disability, that if it was really pointed in the right direction, it becomes an extraordinary ability. And that's something that is being tested all over the place right now. But what I hope will come out of this is that once we get past the communication and the socialization deficits that kids have by getting them what they need when they need it, that so many of them are going to be able to be not just independent, but highly productive members of society. That should be our goal. And the playing field has been set in Michigan now to where that's possible for the first time.
Right.
And when you talk about applied behavioral analysis and the fact that half the people that have been diagnosed with autism could be fully functional or close to, and maybe there are some discoveries that we haven't even thought about yet that'll take some of these energies and maybe direct them in a more productive way than what we've ever thought. But the part that concerned me is when we went to places like Eastern Michigan, when we went to places like Wayne State, the University of Michigan, you can go on and on. We are training some of our best, smartest kids to learn how to not only diagnose at earlier ages, but apply these treatments, applied behavioral analysis and some other similar kinds of things. And we talked about some high-profile people like Frank Beckman at WJR, who, and also I think he's the voice of Michigan football for a number of years, and a lot of other things. A lot of people know who Frank is, but they don't know Frank's daughter has been educated in how to apply this treatment, and yet we don't have a network because we didn't cover this in Michigan. Here, she has to go to, I think it was Illinois.
New England.
Is it New England? Yeah. To get a job, while we've got 15,000 kids in Michigan that have autism that are begging and pleading for someone to help them. I mean, that brain drain that we referenced earlier really is a sad thing that hopefully this legislation will reverse.
It has already started reversing. So Jim Todd leads the Behavior Analyst Association of Michigan, and even if you talk to him, once January, February hit and the legislation was picking up steam, he was getting phone calls from people who had left, and that we've already increased by 5 to 7, which doesn't sound like a lot, but when we're only starting with 40, another 5 or 7 into the state is it's a pretty good thing. So hopefully we'll keep those graduates and draw those back that have left.
Brian, you know, I don't mean to put you on the spot, so I won't. But one of the things that touched me most when I was out listening to testimony is a woman who is a professional woman who educated and wanted a job, wanted to be a productive member of society, and had an autistic child. And the truth of the matter was she just couldn't get anybody to watch the child because there's a 24/7 requirement in some cases. So we've got not only a person in a family having these high costs of trying to get some kind of treatment and control over a situation, they can't go out into the workplace, and the stress at home is hard to imagine, where divorce rates approach 90% in autistic families. I mean, that's the kind of stress we're talking about. So although we measured, and us being, you know, business kind of guys, not you, the two of us, you know, there's more cost than just the dollars. There's cost emotionally, there's cost socially, and these are things that this legislation should reduce greatly, if not eliminate.
It's really a question of productivity as well. It's hard to capture that, but when you consider, you know, this is, you know, part of my life. I live it every day, and we have so many more advantages. We've been able to get some treatment for my daughter, whereas most families go with virtually none. And so what happens is you can't find regular daycare arrangements, so somebody has to be there all the time. And so it affects social life as well, to where you can't really go out, or you don't feel like you can go out. But you know what, I've always encouraged families dealing with autism, though, to still demand to be a part of the world, everything that's happening out there. Sometimes it's disruptive. It's difficult to take a child with autism, particularly one that has never received any behavioral therapy. It's difficult to be out in the open because there's all kinds of problems that can ensue behavioral-wise. But at the same time, the more that we hide away, we don't give people an opportunity to really understand. And I might be naive, but I think I'm right on this, that people want to understand. People want to be there, they want to be helpful, they want to learn more about this, but they'll never be able to if people with autism are hiding. And so I try to be very public about this as much as I can be an inspiration to people to say, if you're one of these families, one of these 15,000 families, and that's just the kids we're talking about, the 15,000 families that are dealing with this diagnosis, stand up and be counted. Be a part of society. Demand to be a part of society. And we're trying to put the right framework and tools in place so you can be successful. And the benefits will be, certainly reduced costs to the government for sure, increased productivity of the workforce for sure as well, and I think you're going to get stronger families out of it as well. You put all these things together, that this is really one of the most impactful reform efforts that has ever moved through this political process.
And I agree, and I'm proud to have been a small part of it. We were at the Autism Alliance, the big gala that DTE had, and we had some tremendous people there, advocates, etc., people that were personally affected. Anthony Ianni, at 5 years old, his parents were told he's probably never going to be a productive member of society, probably never make it through high school, maybe institutionalized for the rest of his life. Probably won't be an athlete, but that's the life that he's going to lead. And all he did was graduate with a degree in sociology from Michigan State University and being part of the Big Ten champion basketball team. So for me, listening to that story, it's not about misdiagnosis or overcoming odds, things like that. It's about the opportunity for 15,000 kids out there to make sure that they aren't put into a situation when we know we can fix them, we know we can help them. There's two real quick things. I don't know if you know this, but Lori, the woman from Autism Speaks in Washington, contacted me and said that the legislators in Alaska looked at Michigan and said, hey, that Senate Bill 981, the one that bridged the gap of those different philosophies, maybe that's a way that we can solve our problem in Alaska too. So Michigan is being an example of a pay it forward kind of thing, where some people were willing to share their personal stories, share their passions, the science, and the people of Michigan came together and said, we're going to get this done, and maybe it'll help people not only in Michigan, but in other states as well.
I think we'll lead on implementation too. I really do. I think we will be the model state to look at for how did they do it so quickly.
Well, Dr. Colleen Allen, a lot of that will be because of you and the Autism Alliance.
Now I'm on record.
Lieutenant Governor Brian Calley, it's always a pleasure. I do appreciate working with you on all the things that we work together on.
Likewise.
And I would certainly like to thank all of you that tuned into the Richardville Report. I'm State Senator Randy Richardville. Have a great day.